Good morning. I'm Dr. Jonathan Chan from the Department of Ophthalmology at the University of Hong Kong. The topic of my presentation this morning is vitamin D as an anti-fibrotic agent for glaucoma filtration surgery. The study was largely conducted by myself and my student Emma Jia. Most glaucoma surgeries use subconjunctival pathway for aqueous outflow to reduce intraocular pressure. These include trabeculectomy, tube shunts, and some minimally invasive glaucoma surgeries. The long-term success of these surgeries hinges on subsequent subconjunctival healing response, especially those from subconjunctival fibroblasts of the Tenon's capsule. Excessive postoperative healing response can lead to subconjunctival scarring and surgical failure. Often this is associated with activation of Tenon's fibroblasts, surgical trauma, long-term use of topical glaucoma medications. Subconjunctival scarring can be reduced through the use of anti-fibrotic agents such as mitomycin C. However, these agents are often limited by cytotoxicity, impaired wound healing, and long-term risk of bleb leak and infection. Vitamin D3 or calcitriol is an essential nutrient produced in the kidney. It acts as a hormone in cells and can trigger expression of various genes. Anti-fibrotic effect has been demonstrated in skin, lung, kidney, and liver. However, it is uncertain whether its anti-fibrotic effect also works on human Tenon's fibroblasts. If vitamin D3 can demonstrate anti-fibrotic effect on human Tenon fibroblasts, then it offers an alternative to the current standard, one which has less or no cytotoxicity and has no effect on wound healing, and also has less risk of bleb leak and infection. Most of the materials from my presentation today is based on our preliminary in vitro study, which was published earlier this year. The study involved primary cell culture of human Tenon fibroblasts harvested from subjects undergoing ocular surgery. There were 9 subjects altogether. 3 were primary open-angle glaucoma undergoing trabeculectomy who have used glaucoma eye drops for more than a year. 3 were patients undergoing retinal detachment or squint surgeries with no previous surgery or long-term use of medicated eye drops. And then 3 were from patients with primary pterygium undergoing excision. Subsequent in vitro testing of vitamin D3 on the cultured human Tenon fibroblasts was then conducted in the following manner. We first confirmed that our cultured cells are fibroblasts using antibodies specific for fibroblasts. We then checked for the extent of myofibroblast transdifferentiation. We then evaluated the effect of vitamin D3 and mitomycin C on cellular toxicity and viability. Vitamin D3 appears non-cytotoxic at concentration between 10 and 100 micromolar, although cell viability appears to decrease within this range. On the other hand, increasing concentration of mitomycin C is always associated with increasing cytotoxicity and decreasing cell viability. This is especially so at concentration beyond 300 micromolar, which is around 0.1 milligram per mil. Note that the usual clinical dose of mitomycin C is around 0.2 to 0.5 milligram per mil. We then conducted further testing of vitamin D3's effect at 5 to 50 micromolar on pterygium and glaucoma Tenon fibroblasts. As you can see, the high safe dose appears to be 10 micromolar. Next, we look at vitamin D3's ability to inhibit cellular proliferation using pterygium and glaucoma Tenon fibroblasts. As you can see, the inhibitory effect on Tenon fibroblast proliferation appears to be dose-dependent up to 25 micromolar. Then look at vitamin D3's ability to suppress cellular migration using pterygium and glaucoma Tenon fibroblasts. Here we're using vitamin D3 at 10 micromolar and mitomycin C at 0.2 milligram per mil. Notice at 24 hours, both vitamin D3 and mitomycin C were able to suppress cellular migration. In addition, using Western blot assay for the alpha smooth muscle actin, we were able to show that vitamin D3 also inhibits myofibroblast transdifferentiation. The third part of our study looked at the molecular pathology of our cultured human Tenon fibroblasts. Here, using RNA sequencing transcriptional profiles of our pterygium and glaucoma versus normal human Tenon fibroblasts, you can see that both the glaucoma and pterygium Tenon fibroblasts show very different expression pattern compared to normal T9 fibroblasts. Next, we use RNA sequencing analysis to look at the effect of vitamin D3 treatment on T9 fibroblasts. As you can see on the heat map here, there were 4,251 differentially expressed genes, or DEGs, in the D3 treated T9 fibroblasts compared to control fibroblasts. Here's a Venn diagram showing the DEGs that are both changed in D3 and mitomycin C treated T9 fibroblasts compared to normal fibroblasts. We then look at the mRNA expression of some of the top DEGs by using quantitative real-time PCR analysis. Here you can see that while some genes are upregulated by vitamin D3, others are downregulated. Our next goal is to evaluate the in vivo anti-fibrotic effect of vitamin D3 in a rabbit model of glaucoma filtration surgery. And we also want to validate the underlying signaling mechanism of vitamin D3. Finally, I would like to take this opportunity to thank my colleagues who have helped with this study. Thank you.